talk about making your legs look good for the summer months ahead. Dr. James Goodin is here with Milligan Vein. Often when he's here, we talk about kind of more serious topics of like peripheral artery disease and venous insufficiency. But this morning, you wanted to focus on spider veins. And I realize as I'm talking to you and you're looking at me that I probably have it all wrong because I'm approaching it from a cosmetic perspective, but there's a real health concern there as well.
Well, it goes both ways, really. And thanks for having me again.
Yeah, you're welcome.
So spider veins tend to be one of the things that a lot of us notice first when we have vein disease, and it's just it's simple because it's what we see when we look at our legs. And we've all seen them. They're just sort of they don't protrude out as much as, say, a classic varicose vein, but there's sort of the reticular, sort of bluish or purplish veins that sort of spread out over at the skin level, and they're unsightly. And patients do come to see me just purely for a cosmetic issue of that, that they're unsightly. But they can be an indication that there's a deeper problem going on.
So what triggers them? What causes a spider vein?
Right.
Just age?
Well, there's lots of things that are risk factors for getting spider veins. They're very prevalent. I mean, by the time we're 40, at least half of us have at least one or two. And it's much more, and that's really kind of a lowball estimate there because it's much more prevalent in women than men. So what are the causes? Well, it is an indicator of venous insufficiency in a lot of my patients, and so the same causes of that can lead to spider veins, and that's genetics. So we tend to have stretchier veins. Other things, being overweight can contribute to getting spider veins. Hormonal types of things. Pregnancy, birth control, those types of things. And
menopause?
Well, it does, like I said, by the time we're 40, at least half of us have them. I think by the time we're 80, or at least women, by the time they're 80, about 80% of them are going to have spider veins.
Right.
So certainly. And like I said, I have patients who come to see me for spider veins, and it's purely a cosmetic issue. But when we really get to talking, the majority of folks that I see have got underlying symptoms that are bothering them as well, and those symptoms don't typically come from the spider veins themselves, but it's really just the spider veins being a red flag that there is an undiagnosed venous insufficiency.
Okay, so let's just say that you're watching today, and maybe you've noticed you're 48, and you've noticed a couple of spider veins. And so you're thinking right now is that, oh, it's just cosmetic and I don't look as good in my shorts as I wish I did. I don't want people to see that thing right there on my thigh.
Right.
And they come to you. Will you then do some type of a test that will let them see if maybe there is more of an underlying concern?
Right. Well, really, the test is just what we're doing right now is talking and doing an evaluation. I'll do a quick exam. And really we're just trying to hammer out whether there are any underlying symptoms, and people can just tell me that without having to do any specific tests.
What would those symptoms be, though?
Just the types of things we've talked about before, like tired, heavy, achy, restless legs, changes in skin tone, and that sort of thing. And so if any of those symptoms are present, then yes, I'll get an ultrasound exam on the patient to see, if there is any underlying vein disease that we need to address.
Is it true that if you have a job where you're standing a lot, that can be a problem?
Absolutely. So prolonged sitting or standing can be a problem when it comes to the circulation in our veins.
So it is a circulatory issue at its very root.
Absolutely.
So if you have a job where you're sitting a lot, maybe get up and walk around.
I would encourage you to get up and move around, take a break every hour and get up and walk around some, or vice versa. If you're, classically the two groups of folks that I see whose lifestyle sort of exacerbates their underlying predisposition for vein disease are folks who spend a lot of time standing in one position, not doing a whole lot of lateral movement.
So like a cashier, for example.
Or someone that works in a factory, or someone who sits a lot, does a lot of sitting, whether they're working behind a desk or a computer or such. If
you have them, back to the 48-year-old who has the two in our example, if you change your lifestyle, will they go away on their own?
They won't go away.
Okay.
But healthier healthier lifestyle, getting down to a healthy weight, eating a healthy diet that's lower in sodium. Smoking isn't a direct cause of varicose vein disease, in my opinion. But it is a secondary cause because it causes heart disease and high blood pressure, which again can contribute to getting vein disease.
So to come and see you, whether it's for a medical concern or the cosmetic side, which is going to be important to the person no matter what the reason for coming to see you.
Sure.
Call, make an appointment online. What's preferred?
Just come. Yes, call, come in and see us.
Okay. Here's where you will find them. It's Milligan Vein, 2 locations. Well, no, I'm sorry, just the one up there in Cleveland. 961-5682 is the phone number. Online, it's milliganvein.com. And really and truly, I know I approached it from the more cosmetic, thinking ahead to shorts weather side, but you don't want to let these things go unaddressed because there can be a real life issue for you.
Absolutely.
If you don't do it. Good to see you.
Good to see you. Thanks.